If you've been dealing with lower back pain, you've probably wondered, what exactly is causing this? Is it a disc, a muscle, a nerve, or is it something else entirely? The tricky part is, lower back pain doesn't always fit neatly into just one category. And that's why it can feel confusing, and why it often keeps coming back. Hi, I'm Alexis Weidland, osteopath and nutritionist at Blossoming Me and Healthy Learning Lounge. And in this video, I want to help you to start making sense of your back pain, so that you can begin to recognize what type of pattern may be involved, and why your symptoms feel the way that they do. Most lower back pain doesn't come from just one thing. Instead, it usually fits into a combination of patterns. But to make this easier to understand, we can group them into 4 common types of lower back pain. Local tissue irritation. This is where the structures in the lower back itself are involved. This might include joints, muscles, ligaments, discs, or even nerves. What this can feel like? Again, we have a few different variations here. Disc-related symptoms often has pain present with bending or sitting, stiffness especially after rest, discomfort straight after getting up, and sometimes pain radiates into the buttock or even down into the leg. Nerve irritation generally has sharp shooting pain, burning or tingling, and symptoms that also might travel down the leg. Plus there could be possible numbness or weakness. Facet joint irritation. Pain is generally when we arch backwards, and often it's one-sided. It can be worse with standing, and there's usually localized discomfort. Muscle or fascia involvement usually has a dull aching pain, tightness, fatigue in the muscles, and it's worse after holding a posture or position for a prolonged period. And importantly, these don't always exist on their own either. You might have a combination of those. Second is movement and load transfer patterns. This is one of the most common and most overlooked contributors. Your lower back doesn't move on its own. It relies on coordination between the hips, the pelvis, the rib cage, and the spine. But many people develop patterns such as stiff hips, reduced rib cage movement, shallow breathing, and uneven movement, causing tension and strain through the fascia of our body. What this often feels like, your back might feel like it's constantly tight and doing too much work, stiffness after sitting, recurring flare-ups. One side often feels tighter and more active than the other. Pain with certain movements or activities. In this case, it isn't just the tissue, it's about how the load is being distributed throughout the whole body. The third one is nervous system and protective tension. This is also a piece that often gets missed. When your body is under stress, physical or emotional, it shifts into a more protective state. This can lead to increased muscle tension, increased sensitivity to pain, and pain signaling to the brain in the first place, reduced recovery and healing. This often feels like the pain tends to fluctuate. Symptoms are worse with stress or fatigue, or you can't quite tell why. There's constant tightness or a feeling of guarding, and there's generally restriction. Plus there's sensitivity to touch or to movement. In this situation, the body is trying to protect you, but the protection can become excessive. The fourth one is referred or organ-related patterns. This is less commonly discussed, but it's very important. Not all back pain starts with the back. The body has connections between the internal organs and the spine through its fascia, through its nerves, and through shared pathways. It can feel like deep, hard to localize pain. Pain that isn't clearly linked to movement or certain positions. It tends to feel a bit different to mechanical type pain. It may come or go. Sometimes it's associated with digestive issues, kidney irritation, menstrual or pelvic organ symptoms. In these cases, the back may be responding to something that's happening elsewhere. Now here's the most important part. Most people don't fit into just one of these categories. They generally do experience a combination of patterns. For example, you might have some disc irritation, combined with movement imbalances and fascial strains and pulls. Plus, your nervous system has increased tension and protectivity. And if we only focus on the one piece, we miss the bigger picture. This is one of the main reasons that back pain can keep coming back, because treatment often focuses on the symptom instead of the system behind it. When we start to understand which patterns are involved, how they interact, and what the body is compensating for, we can take a much more effective approach. In my next video, I'm going to take you one step further, and I'll show you why these patterns exist in the first place. We'll look at how the body transfers load, how breathing influences your spine and your lower back, and how structures like the diaphragm and the thoracolumbar fascia and the abdominal fascia play a central role. Because once you understand that, everything starts to make a lot more sense. The key thing to remember is your back pain is not random. Your body is responding to something. And when you can start to understand those patterns, you're already one step closer to improving it. If you found this helpful, please keep an eye out for the next video. And if you'd like help identifying your own patterns more clearly, it might be worth booking in to see us for your individualized assessment and treatment plan.
So that's it for today. Did it raise any questions or aha moments? If so, I'd love to hear them, so please put those in the comments section. I love answering questions. I hope you found today useful. And if you know someone who could use this information, please share it. Remember to comment, like, and subscribe. Until next time, and in health, bye for now.